Howdy, everybody. This is Jared Sterrett, and you're listening to KZCC LP 106.1 Conroe and KZCW LP 104.5 in Conroe and worldwide at ourlonestar.com.
For Family and Consumer Sciences, always happy to be here for the Extension Hour every Friday right here on Lone Star Community Radio, and that is worldwide at lonestar.com. I got like 20 seconds before I tripped on my words. I try to do it really smooth, but sometimes it just doesn't come out that way. But I do have some smooth talkers in the room. I know a couple of smooth talkers and one fast talker. Dr. Ferry, do you want to say hello because you're the fast talker?
That's right. So I'm trying to be slow. This is Dr. Pamela Ferry. I am a family medicine doctor here in Conroe, and I'm really glad to be joining you guys today.
So glad that you were able to make it. So we've been trying, we talked about a couple of different dates. We had to find an administrative day for you because you stay really busy at the health center.
That's right. We do see patients. That's my primary job is to see patients, but I do get some time to come and be out in the community, which is really one of my biggest passions, to do some community health work. So.
Well, great. We are happy to have you. And Marcella, you want to say hello?
Good afternoon, everyone.
You want to tell them a little bit about yourself?
Yes, so I work at Lone Star Family Health Center, also with Dr. Ferry, and I work right under her with the public health program, doing the community-centered health home initiative that we're a part of.
Yeah, so we're going to talk a little bit more about that today, but let's also let Mike introduce himself and say good afternoon.
Hey, everybody, this is Mike McBride, and I'm also with Texas A&M AgriLife here in town.
Yeah,
Hey.
so we serve all of Montgomery County, doing lots of great things. Every Friday, you usually hear a different host. We have a couple of vacancies in our office now, so we're hoping to get those filled pretty soon. Our 4-H and urban youth development position is open. And also our ag agent just retired after 36 years.
Something like that.
Long time. So we hope to get somebody in those positions pretty soon. So in the meantime, you may hear us a little bit more often. But we love coming to the radio, so we're just really happy to be here. And we always appreciate Dick and the radio station here letting us be here and talk and share with the things that we do. So speaking of the things we do, we try to make announcements every time to just kind of let everybody know what's happening because we stay really, really busy in the extension office. And actually during the spring, it's right now, sometimes I don't know if I'm coming or going. Our master gardeners are also ones who stay very, very busy, and they are busy planning for their open garden day. That's going to be on Saturday, May 5th. So this is a little bit different than they do plant sales twice a year, but open garden days, they also do twice a year, and that's very informal, come and go. It's like an open house, but it's open garden. So you can come kind of see what's going on, visit the gardens that are out there, great demonstrations. You can get your questions answered because there's lots of master gardeners right there on hand to you can ask them questions and you can see things growing, and it's really very immediately applicable information. So pretty cool. And we've got awesome
I'm going to interrupt because I would really encourage people to go. Gardening is one great way to get involved in eating vegetables and learning how to grow them, learning how to eat them, learning how to cook them. There's nothing like homegrown, makes you excited to actually try them. And I think for kids especially, to be involved in that process of growing things will probably make them more likely to eat them.
Most definitely. Yeah, so they, like I said, all kinds of good information because some people I don't even know where to start, but this is a great opportunity to find things out.
I might try to go. I have some. I just had a friend give me some squash plants, and they're flowering, and so I'm very, very excited to see what grows.
Oh, yeah. And did you even know the flowers are actually edible?
Ooh,
you can eat those. Yeah. But anyway, that's your trivia for today.
Sounds like a fun day.
Eat squash flowers. All right. So the other thing that they do besides their open garden days, they do some educational classes that they have. So every month on a Saturday, they do gardening programs. So this summer coming up, June 9th and July 14th. So June 9th, they're going to talk about butterflies. And that's going to be 8 to 10. And then 10:30 to 12:30, they'll talk about bees in the garden. So these are great pollinators. So we'll learn all about these incredible creatures. And then on July 14th, they're going to talk about water for lawns and plants for beginners, 8 to 10. And then 10:30 to 12:30 is water for lawns and plants for experienced individuals. So all about irrigation. And I guess in the heat, in the middle of the summer, heat is kind of when we're all going, oh, do I have to water this lawn? So a lot about how you can do it efficiently, to use water conservatively, that kind of thing. anyway, if you want some more information about any of those, you can call and talk to one of our master gardeners anytime, during business hours, 936-539-7824 or 7825, either one of those. Our 4-H program is really, really busy. We have our Big Time and D9 coming up. And so District 9 is the D9. And we call it Big Time because it's a lot of contests that we do all in one weekend. So May 3rd, 4th, and 5th, we'll be doing several contests. And these are for kids that are in the 4-H program all throughout our district. So we have about 19 counties in our district, and they all come here to Montgomery County, which is convenient for us. But it's also kind of central to the entire district. So Lone Star College hosts us, the Montgomery campus there in the Woodlands, which makes it a great event because they get kind of exposed to a junior college campus. And so these are young people who are thinking about kind of their future, and that kind of helps them visualize it. So that's a neat aspect of it as well. My favorite is the food challenge, and my favorite because that's the one I'm involved with most. But we do, it's kind of like patterned after Iron Chef. So it helps kids learn to cook for themselves. So they also have a food show that they can do individually, and that's going to be held on Friday. And then the food challenge, they work in teams. So teams of 3 to 5, they come with a tub of equipment, and then we give them a mystery bag of groceries. And we say, you have 40 minutes, make something go. Wow. So during that 40 minutes, they figure out what they're going to make, they make it. And they also come up with a presentation, and they take that presentation to judges for an interview and tell them all about the nutrition, the food safety, how much it costs, anything else that they kind of want to tell the judges to impress them. And I'll tell you what, those kids are impressive. You judged before, right?
I have, yeah, both at D9 last year, then also at Houston Rodeo this year. These kids are amazing with the dishes that they come up with and the expertise they show. It's wild. And
we try to focus a lot on vegetables because we're trying to reinforce that healthy aspect. I mean, it was the Montgomery County Fair just happened, and it's an awesome event, and they have food opportunities there, but they're not exactly the healthiest food. Huh? yeah, the pies and the cakes and the cookies and candy and the bread.
Jelly.
But yeah, but to balance that, definitely learning a lot about healthy eating is really important. So some of our 4-H projects help do that. Another thing, we are always looking for volunteers to help with those type of projects. There's something like 600 entries over the course of the 3 days. So there's going to be a lot of kids there. So we can use extra adult help to kind of just help kids get where they need to be. So whether you've got, we need people with subject matter knowledge in any of the areas, but also just sometimes help us move things from point A to point B.
Help herd the kids.
Yeah. Mm-hmm. Yep. Because there's, like I said, definitely a lot. So another thing that they're doing along that time too is a community service project, and they are teaming up with Texas Children's Hospital to get toys for some of the kids that are there. So they are requesting specifically the following items. So they need Lego Duplo blocks. They need Hot Wheel cars, Barbie dolls, Nintendo DS games, wedding bubbles, Play-Doh, Fisher-Price toys, VTech toys, rattles, superhero action figures, and small Lego sets. So those can be dropped off. They can be brought to our extension office in Conroe, 9020 Airport Road in Conroe, or at the Lone Star College. So all of those counties within our district are going to be bringing their donations as well. And we'll get those delivered to the Texas Children's Hospital. So very cool things there. Let's see. We're also we're doing Walk Across Texas in the middle of that, but teams can still sign up. You guys on teams?
We're doing it. Yep.
Yes.
We're on the same team.
Where are you guys at on your team? Do you know how many miles you have?
We're at least halfway across Texas, probably more than that.
I'm not quite sure. I've been a bad team captain, but my team's been pretty good.
Didn't mean to put you on the spot. But,
I'll need a double check.
just say we're doing great.
We're doing great.
Yeah.
Everybody, we did walk around the building for a kickoff. We had a little lunch, and everybody that participated walked around the building a couple times. So
yeah, and what's one of the things that I love about Walk Across Texas? I mean, getting people involved, like in work groups, and maybe doing a little bit more than you would do normally during a work day, because that's kind of what it's all about, is getting people to just do more than they were doing before. Yeah. You know, we don't expect anybody to end the 8 weeks running a marathon, but being more physically active, because that has a big impact on health as well.
Yes, it does.
So then kind of keep you from seeing the doctors quite as often, hopefully. But if you want more information about that, there's a website, walkacrosstexas.tamu.edu. That's where you can sign up, and you sign up in Montgomery County, and you can get in on our community challenge that we're doing during April and May. So our challenge is a little different than some other counties. They have a specific start date and a specific end date, but we just kind of focus on it during April and May. And if you want to join us, we want you to join us. So we try not to be too exclusive in terms of who can participate, because we really want everybody participating. We got some cool prizes that we're giving out. So that's fun. And then, Mike, we also are wrapping up our Families Reading Every Day project.
That is a project I'm learning to love a lot. We're working with the Texas Home Visitors and with the Met Head Start programs in the area. What we're doing the first 2 weeks of the program, we ask the families to read 15 minutes a day with their kiddos. The second 2 weeks of the program, we ask them to read 30 minutes a day. And this is the last week of that program. We're having celebrations in about 10 days. Each kid will get a book, little prizes, and we have little celebrations with them. It's a lot of fun. We get volunteers from all around town to come into the schools and read to these kids. Right. And that's a joy to see these people, firefighters, bankers, all the Entergy folks, just all sorts of folks coming in to help out. It's great.
Yeah, and it's as much fun for the volunteers, I think it is for the kids, because it's just fun to be around those kids for a short amount of time. We're also got some cooking demonstrations and some mobile cooking schools coming up, just to let you know about those. So there's a cooking demonstration at Purvis Library on April 30th at 2 p.m., and then we'll go back on May 21st. And we will do a hands-on cooking school. So we'll show you kind of how to cook in the first class, and then the second class on May 21st, we'll go back and actually let you do it, get your hands in it. So that, and that cooking class will be 5:30 to 7:30. And same thing at Central Library on May 10th, we'll be doing a mobile cooking school at 1:30 to 3:30. And then Mike has a pressure canning class coming up May 12th.
Not canning, pressure cooker.
Did I say canning?
Yeah,
I'm so sorry. Pressure cooker. So like Instapot, but it's a pressure cooker. Anyway, so what time is that? Do you remember? That's a Saturday, May 12th at Metter Library over in Willis.
No, I don't. I think it's early, like 10 o'clock in the morning, something like that.
Okay. So
not too bad of a time.
People can call the local libraries to sign up for any of those classes, find out when others are offered, or you can call us to find out about those classes, or also to schedule one for your group, because we like to go do things for people. But we also have to go take a little break. So we're going to do that right now. But in the meantime, you're listening to Lone Star Community Radio 104.5 and 106.1, and we'll be right back.
Lone Star Community Radio is looking for those who are interested in hosting their own talk show, with monthly and weekly slots available in Conroe's FM 104.5, 106.1, and on irlonestar.com. Start your own podcast, create your first YouTube channel, and be on TV. Contact Lone Star Community Radio online at irlonestar.com or call the station message line at 936-647-3776 to take your first step into the radio world.
Relax with a cup of joe or your favorite drink for the Conroe Lake Conroe Chamber of Commerce Chamber Chat. The show airs on the first Tuesday of the month at 11 a.m. on Lone Star Community Radio. Join hosts Courtney Galley and Brian Bondi as they chat about the Chamber's events and programs for the month, and invite Chamber members into the studio to talk about their upcoming events and businesses. Learn about your Chamber with Chamber Chat every first Tuesday at 11 a.m.
Welcome back on this lovely afternoon. Today is April 27th, and tomorrow is April 28th, because, the 27th comes after the 28th, right? And so this is Amy Ressler, County Extension Agent, Family and Consumer Sciences. You're listening to the Extension Hour, and we are in downtown Conroe, and it is buzzing right now because they're setting up for Kids Fest tomorrow. So we were talking just before we went to the break about some of the activities that we've been doing, but Kids Fest is one of those things we really wanted to focus on. So it is tomorrow. Downtown Conroe starts at 10 a.m., ends at 5 p.m. It's kind of come and go, so you can stay as long as you want. Lots and lots and lots and lots of activities, and pretty much everything's free. So free admission free parking, free activities. There are some food vendor booths that you can buy food from, but almost everything is free. So it's a really great time for the family to just come out and really have a good time. And the weather's supposed to be gorgeous tomorrow.
Supposed to be beautiful,
So yay. And even if it wasn't, Kids Fest is determined to hold it, whether it's rain or shine. But tomorrow it'll be sunshiny and beautiful. And we're going to be there at the Health Village. Mike, tell them about the cool thing that we have going on.
Okay, we have something called a blender bike. And what we want to do is teach people that there are healthy alternatives to sugary drinks. I'm sure the doctor can agree with that.
Absolutely. In fact, we'll be talking about that in our booth as well, but go ahead.
Okay. Well, the blender bike is like half of a bicycle, but on the front wheel, we've attached a blender. So we have people come up. We put in 1 cup of unsweetened apple juice, 1 cup of frozen strawberries, get the people to start pedaling and blend a smoothie. And we'll be giving samples of that out along with the recipes and information about what sugar does or ways to avoid it if you can.
Yeah, life's all about choices. So I love the way you said we put that blender on the front, like, you know, like we came up with this idea.
We bought it.
We bought it that way. Yeah, it's a pretty cool concept that they have. I think it's called Rock the Bike is the company that comes up with it. So
they've got one with a generator and all sorts of fun things.
Yeah.
But it's a great way. You get your exercise and then you can have a healthy snack.
Right,
Yes.
right.
Right.
You know, and it's not like practical. It's not like something that you would have at your house where, ooh, I'm going to blend my smoothie. But just to reinforce those ideas of physical activity and healthy eating. So we're pretty excited about that. And there'll also be lots of other organizations out there. Roger Stein Chiropractic actually sponsors the Health Village. And so they'll be out there doing free screenings. Montgomery County Women's Center, Tri-County Health Services, several of their subgroups are going to be out there. They've got lots of projects, kind of like we do, and like you guys do over at the Lone Star Family Health Center. There's just lots of things that kind of fall under our umbrella. So Tri-County will be out there as well.
We'll have a booth out there. We're going to be focusing on the healthy aspects of water, and water is a great drink for any occasion, and looking at the comparison of that to other types of beverages.
We're going to be looking at the sugar content of what's in a soda, what's in a Minute Maid drink, what's in a Snapple, and then how much sugar is in water. Well, that's 0. So we'll be handing out some sports water bottles from Lone Star, and then we'll also have the dental bus out there that's going to be providing some toothbrushes, floss, maybe some little goodie bags with some of their dental stuff.
Cool. So will people be able to look inside the dental
Yes, we're hoping
bus?
that they can get in the bus and take a little tour.
Yeah. So if you're afraid of the dentist office, the bus is like a good alternative, right? Maybe.
Yeah. Well, our bus actually will be traveling from clinic to clinic. So I think here pretty soon it'll be in Willis. So it's a good way to.
Mm-hmm. So that's another cool thing about you guys are expanding. You've got additional clinics. So let's just talk a little bit about the Lone Star Family Health Center and kind of why it exists and where it's at and the additional clinics that you've opened recently.
For those of you who don't know, Lone Star has been around for years. We are a federally qualified health center, which sounds like a scary thing, but basically means that we are there to serve people who have insurance or don't have insurance, or basically we are there for people who need to get health care, especially preventive health care, but we have a variety of services really there just to serve the community. We have a dental branch, so in the main campus, which is right off of the South Loop 336 next to Conroe Regional Medical Center. We have a dental clinic. We also have a pretty large health center where we can take care of preventive things, kids, children, pregnant women. We do all the OB care. We have a couple ultrasounds for the OB clinic. We also do all kinds of adults, diabetes care, chronic care, acute visits. You have a fracture, we have x-rays. We also have splinting. We have a variety of procedures we can do there in the clinic. And we also have after-hours clinic, so evenings, Monday through Friday, and then Saturday mornings. So for people who work and really just can't get in, you're welcome to walk in any of those days as well. We have a number of doctors. We've expanded because their services really are so needed. We all know that healthcare and health insurance are difficult to come by these days still. Sure. So we have a clinic in Willis and one in Spring. And this year in February, we just opened a branch in Grangerland, which I'm very excited about because that's where I go. And it is actually on the campus of Conroe ISD. There it's
between Ben Milam
yes,
Elementary and Grangerland Intermediate. Right back.
And so it's kind of just back. They've given us a little spot of land, and we're open 2 afternoons a week from 3 to 7, the Mondays and Thursdays. We'll take walk-ins. We're really happy to have any kids who are sent home from school and are sick, or people who live in the community who just need to be established in care with a physician for ongoing care. We will have vaccines. We're not quite there yet. We've got approval. We just need to get them in. And we can do physicals, sports physicals, you name it.
So pretty much anything you need,
exactly.
Lone Star can kind of take care of
And
that.
then the nice thing is if you don't have insurance, it doesn't matter. We have a sliding scale. You sign up and we can give you very low cost care. If you have insurance, we take almost, I think, pretty much everything. So
yeah, and
we
also
welcome
even
everybody.
my adult children have come in from out of town, and inevitably they get sick while they're here, and I've taken them to Lone Star to get services. So
And
it's easy, friendly.
And the other thing is we speak Spanish. I mean, there's always a Spanish speaker. I speak Spanish, and many of the doctors do, and all of the nurses pretty much speak Spanish. So,
Perfect.
yeah, we'd love to see you.
All right. So in addition to providing healthcare services, you guys also have some grants and you do some additional things because it's more about helping people not have to come to the clinic as it is.
Exactly.
You really don't necessarily want people to come to the clinic. I mean, you're there to serve them when they need it, but ideally we have a healthier society and people don't need
Right.
the
That is
health centers nearly as often.
definitely one of our biggest goals. We are all about prevention. And that to a lot of people means just vaccines and getting your teeth cleaned and those kinds of things. But we believe that prevention is much broader than that. It's really about how you live your life. And so we have a slogan that says health happens where we live, learn, work, and play. So a lot of health takes place at home. Do you eat healthy? Do you exercise? Are you getting enough sleep? Are you drinking enough water? Right. Those are the things that really matter. Do you have healthy relationships? Are you doing things that are fun and enjoyable? That's the home site. I mean, and our community makes a big piece of that too. Are you able to get outside and exercise? We know there's some places in the community where that's really difficult.
Right.
But there's ways to do that even then. But we really want to focus on helping the community be healthier. And that means, each family, each individual, workplaces, public places like parks, public places in the community where maybe we can make those places safer to be and more healthy in general in the environment. That's one of the projects that we have going is called community-centered health homes. And what that means, it's a big word, but it means that we want to be a health home for people, not just when they get sick. We want them to think of us as the place where they come when they get sick, also the place where they come to just get a checkup and say, hey, how am I doing? Do I need to be watching my blood pressure? Should I lose weight? Do I need to be taking any medications? And then also, we want to be a home for the community. So we want them to come to us, hey, we really want to take care of diabetes in our community because we know that everybody, we have a huge rate of diabetes, for example, and that's really an epidemic nowadays in Conroe as well as other places in Texas, as well as obesity, which is one of the biggest associations with diabetes.
Right.
And, how do we prevent our kids from having those same problems? How do we live in a healthy way so we don't get diabetes and we don't develop all the things that go along with being obese? And a lot of that has to do with eating healthy foods, learning how to cook healthy foods, which you guys are really doing a great job of teaching about that, getting out and being active, and just having other activities to do besides eating. So yeah, we really want to work on that. And we realize that it starts in the community. It starts at home. It starts in having communities that are focused on health. With Kids Fest, we're really trying to promote a lot of healthy activities and healthy habits and fun things to do outside of the home. And it's about educating ourselves to learn how to manage our health and manage our diseases. So we really want to be outside of the walls of our clinic. That is the biggest thing. And we want people to know that if there are things that they think could improve the health of their community, we'd like to help partner with them to help take care of those things.
Right. One of the things I love about the coalition that you guys are putting together is that it is taking that community approach. And how can we all work together to make sure that we're all addressing healthy habits and how health happens, where health happens, so that people hear it kind of everywhere that they go, and there's some consistent messaging and some where it just kind of becomes a part of our culture and a part of our lifestyle that what we do is healthy things.
Yeah, so this committee started last year when Lone Star Family Health Center decided that we needed to do this grant. And this grant provided us the ability to create the committee to address childhood obesity. About 50% or more of our pediatric patients that see us at Lone Star Family Health Center are obese or overweight. The majority of them being here in the Conroe 77301 area. So we're focusing on that. But we really did bring this committee and this group together to address it as a team, as a community, not just one organization trying to do something about it. So we really want to partner up with you guys in advertising the programs that you guys are doing, the nutritional classes. And then the committee created a survey, which I can go into detail in a little bit, as to what kind of information we're trying to gather so that we can really put our focus on what is the main issue in the community.
Right. And like I said, I love the idea of all of us coming together to address those kinds of things, because one of the things that we struggle with sometimes, we have these great classes, great things that are happening, but people sometimes don't know about them.
Right.
But as we gather in coalitions and we talk to each other, as we come across clientele and people who need help, it's easy to say, oh, have you heard about this? At Lone Star Family Health Center, they can address these kinds of things. And Parks and Rec has these kinds of things. And the Extension Office has these kinds of things. And so I'm just kind of referring people to the services and the help that they need so that it's really easy.
Definitely don't have to reinvent the wheel. We have the interventions in our community. It's just how do we use them and where.
Okay, so I want to talk about that some more. There's lots of great information to talk about, and I want to talk a little bit about the importance of it. I mean, and I think that we can say, oh yeah, it's important, but let's kind of look at some of the statistics and the facts that are happening. But we have to take a little break. We'll be back in just a moment. You're listening to Lone Star Community Radio and the Extension Hour.
The Texas A&M AgriLife Extension Service has been dedicated to educating Texans for over a century. In 1915, the Extension Program was established under the federal Smith-Lever Act to deliver university knowledge and agricultural research findings directly to the people. Ever since, AgriLife Extension programs have addressed the emerging issues of the day, serving diverse populations across the state. Texans turn to Extension for solutions in horticulture, agriculture, 4-H and youth, and family and consumer sciences. Extension agents respond not only with answers, but also with resources and services that result in significant returns on investment to boost the economy. Join us Fridays at 1 o'clock for the AgriLife Extension Hour.
A Lone Star Community Radio is looking for those who are interested in hosting their own talk show, with monthly and weekly slots available on Conroe's FM 104.5, 106.1, and on irlonestar.com. Start your own podcast, create your first YouTube channel, and be on TV. Contact Lone Star Community Radio online at irlonestar.com or call the station message line at 936-647-3776 to take your first step into the radio world.
Welcome back. You're listening to the Extension Hour. This is Amy Ressler, Family and Community Health Agent and here in Montgomery County. And I've got Mike McBride with me. He's our Family Community Health Program Assistant. And then we have two lovely ladies from the Lone Star Family Health Center with us, Dr. Pam Ferry and Miss Marcella Byers. And I told you, I always try to leave the R out. I don't know why I want to say Byers, but anyway. And I have one of those names too. People often mispronounce it often. So anyway, we've been talking a lot about the community center health home. We've been talking about Lone Star Health Center and the things that are affecting our community. And so, we hear a lot on the news about childhood obesity, but sometimes people don't really understand what that means for them locally in our community. And then also kind of what does that mean for the future of our society and our generation? You had mentioned when you were talking earlier, Marcella, that like 50% of children that you guys see at the clinic are overweight or obese. So that's half the kids that are coming in. So we're seeing that a lot.
This is Dr. Ferry. It's a concerning trend. Obesity is sort of a medical term, but what we really are talking about is an unhealthy weight. And, it starts early in childhood. We're seeing it more and more. The trend in the U.S. and probably somewhat around the world is that as people get a little bit better off and a little more sedentary in the types of jobs that they do, which has been a trend for a long time, there's less activity, there's more access to foods that are high in calories and high in energy, and less ways to burn that off. And so we've seen this trend in the U.S. in almost every state, and Texas is probably the worst one, of adults being much more obese, meaning they're weighing way more than they used to. And it's associated with so many health problems. You know, I see patients every day with diabetes, high blood pressure, heart problems, swelling in their legs, back pain, joint pain. All of those things come from having too much weight, more weight than you need. And it's such a hard problem. And I think we've all struggled with losing weight at some point or other, right? It's so much easier to put it on than take it off.
Yeah.
It's a lot more fun.
Yeah, well, it is.
Lots more fun to gain it than to lose it.
I don't know. There's some really fun activities out there, but yes. And any physical activity is probably more fun when you don't weigh too much, right?
Exactly. Yep.
But so it really starts in childhood. And, you know, there's a lot of different research out there now about what, you know, when it starts and how it starts. Certainly overfeeding is a big aspect, even among infants. And at 6 months, even to 2 years, as children are overweight, that just sticks with them for the rest of their life and puts them at such a disadvantage because children don't really know how to eat. They learn that from their parents.
Right.
And so we see these children even at age 4 or 5, early in life, who are overweight, not very active. They spend a lot of time in front of the television or playing games on their cell phone, don't get out as much. And there's many, many reasons for that. I mean, we understand it's hard. Parents may not have time to take them out. There may not be a safe neighborhood to play in. There may not be time for the parents to help them and encourage them to engage in activities. And, you know, of course, the easiest foods to eat are usually the ones that are the worst for you.
Right.
Highest in calories, highest in carbohydrates, fatty foods, fast food. I mean, if you can get $1 burger and fries at McDonald's, why are you going to go spend $1 on a smaller portion of vegetables that your children probably won't eat anyway? So there's a lot of struggle with eating the right way. But we do know we see even more diabetes in adolescents now. So children in 12 to 18 range, they're beginning to get diabetes, type 2 diabetes at this point, and it's hard because you know that those people are going to struggle throughout their lives with health problems that they probably could have prevented if we'd worked with them earlier on. And so we're really trying to get out there and educate parents and children about what it means to be healthy, what a healthy weight looks like, and why it's so important to start early. But we know that's not the end of the story. And Marcella has some background in public health, and so this project is really trying to discover, okay, what are the barriers that people face to cooking healthy or eating healthy or getting better activity in order to have a healthy weight. We want to know more. We understand some of the issues, and maybe you can speak to that a little bit, but we also want to understand more about what is happening in our community for those people and what would it take to help them become more healthy in that sense.
And so one of the best ways to understand what people are going through is to ask them, right?
Exactly.
Yes. So we have, the coalition itself created a survey with about 12 to 13 questions, really trying to get in the nitty-gritty of what's going on at home. You know, are you eating as a family together? When you're eating as a family together, most likely you're not watching TV. Are you participating in any outside activities? Is it safe for you to play outside? Do you eat 5 or more fruits and vegetables a day? If not, why? Those are the questions that we're trying to figure out. Can you get to a grocery store? Is that an issue? Is cost an issue? And if that is an issue, we're trying to come back and say, okay, so if these are your reasons why you can't eat healthy or your barriers, then how do we fix them? And how can we get you to a grocery store or a food bank or a pantry? Or, can you do a home garden? Is there other things that you can do, to make your barrier something that can help at home? Sorry, I probably put that in the wrong words. But
Well, just to keep it from being a barrier. So,
yeah. You've got a barrier, but let's overcome it by doing something different that maybe they haven't thought of. We know education is a big piece, and we know we're going to be providing some education at some point.
But it's not enough.
It's not enough. We really want to get out there and really talk to the community.
Because I may know how to eat healthy, but when I go to the grocery store, my budget only goes so far.
Exactly.
Am I going to buy, a bunch of vegetables that may go to waste or that I don't know how to cook or that my children won't eat? Or am I going to buy, the big bag of rice and, tortillas so that I can fill everybody up and everybody likes it?
Everybody likes it.
Yeah, it's a complex issue, and it's going to take a multifaceted approach to solve that issue.
Right. And getting with our partners, too. You guys do the education classes, the nutritional classes, how to cook certain things. People don't know how to cook vegetables, and vegetables actually can be really tasty. So we really want to get to the nitty-gritty of what's causing it, it is childhood obesity, but like Dr. Ferry said, it's a learned behavior. The parents are what's causing it, and a lot of the times the parents are obese themselves. So we really want to get into these families and see what's going on. And tomorrow, we'll be doing the survey. So come by our booth for sure and interact with me, and let's talk about it.
Yeah, well, we know that a large part of Conroe, even 77301, there's not a grocery store very close by. Your easiest buy might be at the local
gas station,
exactly, or and so. Again, we want to. I think with your help too, like you have some cooking classes. Well, this is great. Let's have some ways to cook healthy. You might even be the same foods you're used to, the type of food you usually eat, but let's make it in a healthier way.
Yeah, we have one that is kind of fun. It's called a Chinese chicken salad. That's a recipe that we show people what to do with, and it uses ramen noodles, which ramen noodles
cheap. I'm 35 cents for a thing of them or less. Yeah,
exactly.
It's great.
But we put it with a lot of cabbage, a little bit of chicken, and it can even be canned chicken, which is not necessarily inexpensive, but it can stay on the shelf for a long time, so you don't have to worry about it going bad and that kind of thing. And you make like kind of a dressing along with the little spice packet that's in with the ramen noodles, and a little bit of green onions, a little bit of bell pepper, and it's just really, really tasty, and kids will eat it. You crunch up the ramen noodles and put them on top.
Yeah,
and so
kids eventually will eat what you put in front of them.
That's true. Hungry enough, you probably eat anything. But I think so. There's a lot of psychological things that go along with it too. So kind of an interesting article that I read was about parents who overfeed their children. And it's not necessarily that they mean to overfeed their children and they don't want to make their children overweight, but providing food as a reward can be a relatively inexpensive thing. So I can buy my kid a candy bar for, 50 cents, whereas maybe another family that's got much more in terms of resources can go to, whatever. We can take a trip or we can go to the movies or we can do things that cost much more money, but food is a really cheap, easy reward, and we want to make our kids feel good.
Right, and I think food is something that we all share. So in a cultural way, eating together is a fun event, and eating in general just is something that makes everybody happy. Unfortunately, I wish we didn't have that much of an attachment to it. We need to eat though, and it's something that we need, and so now we need to figure out how to put that together with the good, tasty part of it, but also in a healthy way. But yes, I don't think parents ever mean to overfeed their children, but it is easy to do. You take the wrong cues in the beginning. In the first 3 years of life, sometimes they can't tell you what they want.
Exactly.
And you think that they're hungry and they'll take it and they'll eat it, but then, you realize maybe they just wanted a hug or wanted to sit down and have you spend time and read to them.
A little attention,
So, yeah.
I worked as an addictions counselor. I know a lot of people use food as an addiction. They get rid of other habits.
You reward.
You get stressed. Well, for me, here comes a bag of Oreos.
Yeah, no, and there is definitely some research that shows that sugar is addictive.
Yes.
And it does help relieve stress. Stress leads you to want sugar. Sugar helps relieve stress, and then you get into this pattern of stress eating, and it's
Quite a
very hard to
cycle.
break.
And it's a little different than other types of addictions that people can get into because like you mentioned earlier, you have to eat. We can't go without food. So food is a non-negotiable in some aspects.
Yeah.
It's just
That's right.
the
I can
choices
go the rest of my
what
life
kind
without a
foods.
cigarette, but you're not going to live real long without another.
True.
Right. All right, so we've got the survey that we're going to look at what it is that really prevents people. So we anticipate that it's going to be a pretty complex answer. I mean, the data that we'll get from that will not show that it's just one easy fix.
Yeah.
Because if it was an easy fix, it would be done already, right?
And different initiatives should come from the survey. We know education's a big one. I keep saying that and keep going back to it. We want to do the 5-2-1-0, the eat 5 or more fruits and vegetables, 2 hours or less of screen time, 1 hour or more physical activity, and 0 sugary drinks. So we know that's going to be a big educational piece, but then what else do we need to do in this community to really help? What education do we need to do? We're hoping the survey will also lead to some focus groups. So in the survey itself, it's asking, what's your street address? What's your zip code? So that we can get into the communities a little bit more to the nitty gritty and finding out, okay, why aren't the kids playing outside? What's going on? Are their parents working all the time? Do they need a different activity? Do they need to know what recreational activities are out here? Is the park not safe? I know that was an issue a year ago that's already being worked on at one of the parks around here. So I think with the survey, we'll be able to have different initiatives where different
communities.
organizations can come together and really make a difference.
Yeah. again, like I do think that it's great to come together and to address that. And then, but when it comes down to it, it really is an individual choice. So you can have the healthiest community, but that doesn't necessarily mean that individuals are making those choices. So part of it too is helping it make it easier for people to make healthy choices.
Exactly.
But again, it comes down to individual responsibility. So when we get back, let's talk a little bit more about that. So because we have a doctor on call right now, anyone that has any questions that they want us to ask, you could call the station. But in the meantime, we're going to take a little bit of a break, and we'll be back in just a minute.
She's got a red neck and a head of red hair.
Hey guys, this is Connor.
This is Dick.
This is Chris. And we're with the Ticket Stub Podcast every Thursday live at noon on 104.5 and 106.1 FM in the Conroe area. Also, anytime at irlonestar.com. You go to irlonestar.com/TTS. You can find all of our social media.
And don't forget, we give away 2 tickets to the Grand Theater on every show.
If you like movies and you like complaining or celebrating anything that has to do with the silver screen, check out the Ticket Stub Podcast and join us every Thursday at noon o'clock on Lone Star Community Radio.
Hey, Montgomery County, it's me, C.C. Holmes. And I would personally like to take this time to invite you, that's right, you, to join me every Saturday and Sunday from 3 until 7 p.m. where I will bring you the very best of smooth jazz, classic jazz, and indeed, yes, the soulful sounds of the 60s, 70s, and 80s. So come along and get jazzy with me. That's right, jazzy. Right here, of course, on Conroe's 104.5 and 106.1 FM, or worldwide at irlonestar.com.
Welcome back. You're listening to the Extension Hour. I'm Amy Ressler, County Extension Agent, Family and Community Health. We've got Mike McBride, we have Marcella Briers, and we have Dr. Pam Ferry. So while we have a doctor in the house, it's like making a house call. We've got you here to get all kinds of great information. We've been talking a little bit about childhood obesity. We talked about diabetes, and you were mentioning that a lot of children now are getting type 2 diabetes. And I think that the thing that people maybe don't understand the difference between, we used to call it like childhood diabetes and adult onset diabetes. Now we call it 1 and 2. So talk a little bit about the difference between 1 and 2, and then why the 2 is so alarming.
So diabetes is basically a condition where your body does not process sugar well. And type 1 diabetes, generally speaking, happens when somebody's body creates essentially attacks its own pancreas, which is where we produce insulin. Insulin is what helps us process sugar. And so that is a whole different piece of it. It used to be called childhood onset because often it happened in childhood, and it still does. But it is really what we call an autoimmune type of diabetes. Type 2 diabetes is really more a disease of really obesity. So what happens is people become resistant to their own body's insulin. So it's body fat, especially body fat around the belly, around the middle, actually keeps you from utilizing your sugar as well. And so your insulin goes up and you become more resistant to it. So you end up needing more insulin to process the sugar that you eat. That doesn't really, maybe that's not a very good way to describe it, but essentially it is a disease of people who have much more body fat or an unhealthy weight. It tends to go together. Not always, but for the most part. And that is what we're seeing as people in our country and in our state get more overweight, they are more likely to get diabetes. Type 2 diabetes specifically. And type 2 diabetics don't always need insulin. So when you hear that, it doesn't mean that you're going to have to be taking shots for the rest of your life. Mm-hmm. Usually we can control that in the beginning, at least, with medications by mouth. So people have heard of things like metformin or something like that. And those help us to process the sugars and really keep our insulin levels down. But eventually, if you really don't take care of yourself, you may end up needing to have insulin injections. We try to avoid this by helping people understand how to manage it. And things like losing weight, being active, even if you don't lose a lot of weight, being active every day and increasing your activity levels helps. Eating healthy and staying away from really sugary, very simple carbohydrates, which are things like, unfortunately, the things we like to eat, rice, tortillas, white bread, those kinds of things can increase your sugars more easily than, foods that are more complex like vegetables and salads and things
whole
with
grains,
high fibers.
yeah.
Exactly. Whole grains, exactly. So as we see children even become more overweight, they have more of a risk of getting diabetes. And we'll see a lot of people with what we call pre-diabetes, which means they're just about on the border of becoming diabetic. And that's when you really can intervene and say, okay, if you can lose even just 10 pounds, or if you can start to eat healthier, drink water instead of juice, or instead of soda especially, water is probably the healthiest thing you can drink. And sugary beverages like juice, like pure juice, which often has added sugar, but even if it's just pure juice, a lot of times it's a very simple sugar that gets processed quickly. Soda is particularly bad. So water. I know there's a lot of people who think that children need juice. It's much healthier for you to give your child a section of orange, or several sections of orange instead of orange juice. They get a little bit of fiber with it. They get much more of the vitamins with it. Or let's say an apple with, just a piece of apple is much better than apple juice. And I think there's a misconception that we need juice to keep our children healthy, but they'll get the same vitamins and nutrients, and even better, from the fresh fruits and vegetables too. A lot of the vitamins we think are in juice are actually in the vegetables. So, so again, that's just one way to kind of keep your children from getting obese, because that sugar also fills them up, makes them want the sweets, and then they tend to not want to eat the other healthy things that they have on their plate.
So diabetes is one of those chronic diseases, which means there's really no cure for it. It's just one of those things that once you have it, it's going to be a part of your life continuously.
And it, generally speaking, gets worse unless you take care of yourself. Now, I have seen people go from needing medications to not needing any medications.
And a lot of that has to do with lifestyle choices, what they choose to eat, what they choose to do. Sure.
Exactly. So I've seen people who lose a lot of weight and really work hard, and they really don't need to take any medications. We still monitor them and make sure, but it can really make a big difference.
And so as more people are getting diabetes, there's more diagnoses of diabetes. What does that mean for our future?
So, diabetes is linked to so many other problems, unfortunately. Many diabetics also have high blood pressure. Diabetes can affect your kidneys. And so over time, you can end up, many people who've had diabetes for their whole lives can end up on dialysis, which is a horrible way to live, and is also very expensive. Diabetics also tend to have a lot of nerve problems. So you see people who have a lot of pain in their feet, especially, or in their fingers. That comes from diabetes, and those things can expand over time. And when people have poor nerves in their feet, they can get an injury and not realize it, and those things can get affected. And one of the things I think people don't realize is diabetes affects all of your circulation. And so your blood vessels become more likely to get blockage in them. That includes the ones to your heart. And so people get heart attacks with diabetes are much more likely to have that problem. And that also includes your brain, so risk of stroke. But then people don't realize, but it also affects the blood flow to your feet and your limbs, your lower legs. And so this is why a lot of diabetics end up with amputations, because they really don't have good blood flow. They get ulcers on their feet, and then eventually those get gangrenous and have to be removed, unfortunately. That's very extreme. But it does happen. And I think that's people's biggest fear is that if I start taking insulin, that's going to happen to me. But again, like I said, if you really start catching yourself before you even get diabetes, or when you're pre-diabetic, or early in the phase, and really work hard, I think we can prevent a lot of that. Those things are very costly. Imagine just the suffering and pain and toil it takes on the family. It just disrupts your productivity, your ability to work, your ability to take care of your own children, your own family, not to mention the health costs that represents. The hospitalizations, the medications, the surgeries. So
I just want to interject here just a little bit. One of the things about the Walk Across Texas project that we do is it's more than just an event or something to participate in. We actually are able to do some calculations on economic impact of Walk Across Texas. So based on the fact that people between the ages of 18 and 64 are becoming more physically active, if they continue that level of physical activity, if they continually be physically active throughout their lives, then that means that they're going to reduce the onset or delay the onset of type 2 diabetes. They're also going to have fewer work absences, and that will save a lot of cost. And so we're able to do these calculations that give us this economic impact. I say we're like the computer does it, but our economists come up with the formulas that are able to calculate that. But it's millions of dollars when we're talking about, like last year we had about 800 people participating. It was something like $7.8 million that we can save because of that.
Let's bring it back to a single person with diabetes. Usually a diabetic, by the time they've been a diabetic for 10 or 15 years, is on maybe 5 different medications. Do you know how much? Even if they're all $4 a month, that's, $20, $30 that you're spending on medications, and insulin is much more expensive than that. So it becomes a big cost. to the person, to the family itself. So again,
Right. So sometimes people will complain that it costs a lot to eat healthy or it costs a lot to be physically active, which may not actually be completely true.
Right.
It's all a matter of perspective.
Yeah.
But it also costs an awful lot to be sick.
Yeah, walking doesn't cost any money.
True.
You can walk, if you're scared of your neighborhood, you can walk in your house. You can dance in your house. Those are all great activities. But again, at Lone Star, we really try to provide medicines that are generic, that are the lowest cost possible, because we realize that when you have 5 medications, if there's something that's not on the generic $4 list, it's going to cost you a lot more money. So, we see Medicare patients, adult, over 65 people who have these chronic health problems, and they're spending a couple $100s a month, even with insurance, on their medications. And that's very difficult. You have to make a choice then between, are you going to eat or take your medications? Are you going to go see your grandchildren, or are you going to take your medications? So it's a lot to think about.
And like you said, it's easy, and water is free.
Yep, water
so we're
is
talking about drinking water as opposed
right.
to sugary drinks or fruit juice or that kind of thing. And fruits and vegetables can be pretty inexpensive as well. It's all, if you compare the cost of an apple to the cost of a grab bag of chips, the apple's really less expensive. So definitely, like we said, life's all about choices. So Dr. Ferry, tell us some good news.
Some good news. Well, we are, again, we're here for you to do education. We're really working on having some more information about diabetes, starting some group classes for diabetes at our centers. Again, we're really trying to help you before these things happen. Bring your kids to get a checkup. Bring yourself to get a checkup. We catch things early. We can certainly help you prevent these lifelong diseases. Again, we've got some great opportunities even now at Kids Fest to learn about things you can do to protect your health. We'll be out at our health centers and in the community as much as we can to provide information and support.
Yeah. Marcella, good news. Closing thoughts?
Good news. Go for a walk.
It's beautiful
you
out
can
there.
do it
It's
yourself.
great weather.
Yeah, the weather's perfect right now. Enjoy the outside. Go for a walk.
Yeah.
Take some people, some neighbors, some friends with you. You don't have to do it alone. It's easy and cheap.
Or if you're an introvert like I tend to be, it's okay to do it alone too.
Put some headphones
Either
on.
way,
Go
that's
for a
right.
walk.
Don't talk to me while I walk.
I know this was. If you're embarrassed to go to the gym because you don't have the right outfit, you know what? Stay at home, walk in place. Put some good music on and dance your heart out. Nobody's going to see you, and that's great for you.
Yeah, most definitely. Mike, you want to say anything else?
Yeah, some of the classes I teach are taking family recipes that we all love and trying to make them a little bit more healthy.
Absolutely.
And if you have questions like that, Amy gave some phone numbers earlier, but also contact us at Healthy Living in Montgomery County on Facebook. I'm on there just every day, so I'll try to answer any questions you have there as well.
We try to post a lot of really helpful articles on that too. All right, and then listen every week to the Extension Hour because we have awesome guests and we talk about great things. And we will be back again next week and every Friday right here 1 to 2 on Lone Star Community Radio. Thanks for joining us today. See you next time.
Thank you for checking out this production of Lone Star Community Radio. Lone Star Community Radio is Montgomery County's community radio station. Don't forget to check out this show and many others across the Lone Star Community Radio Network, either live on Conroe's FM 104.5, 106.1, the Lone Star Internet Radio app, or irlonestar.com's live audio stream, and on replay on podcast, Channel 12's Our City TV in Conroe, or Channel 21 KVQT in Houston, and of course their YouTube channel. This production is copyrighted and all rights are reserved by Lone Star Community Radio. Have a question regarding this program or other Lone Star Community Radio shows? Want to sponsor or start your own show? Call the station message line at 936-647-3776 or email the station at lscrstudios@gmail.com.